Hello, my name is Jasmine and I'm from Uganda. Um, I am a cancer patient. I've finished all the cycles of chemotherapy and my doctor advises that I go for a bone marrow transplant because they cannot afford to give me any more chemotherapy. My body has reached its maximum capacity and the only option for me right now is to do a bone marrow transplant. How did I get here? In 2019, during the COVID pandemic, I was taking care of my niece who had gotten burns, and we spent 2 months in the hospital. And during that time, I was constantly exposed to sanitizers. So after like 2 weeks, I started feeling the hardness in my hands, and I thought it was because of this constant use of sanitizers. But when we were discharged from the hospital, I realized that my hands started peeling and my feet. So I started visiting dermatologists and they were telling me it is just an allergic reaction. So for 3 years, I was misdiagnosed for eczema, for allergies, common allergies. But I didn't know that I was faced with something that was very serious. So during that time, I started really falling sick. I started losing blood, being anemic. My skin would be yellow, yet initially I am a chocolate-skinned person. But I started becoming yellow and people thought that I was bleaching. So one day in 2023, my feet started really swelling a lot, and when I went to the hospital, they told me that I was about to die because I didn't have blood. My hemoglobin was at 5. So I was arrested in the hospital. They admitted me immediately and they had to transfuse me. They had to give me a blood transfusion. And they did investigations. I didn't have any blood leakages. I didn't have any ulcers. And they got concerned. So they said, we have to get to the bottom of this. We have to do thorough investigation. So I saw a physician and very many tests were carried out, blood tests, stool, urine, and they also did a biopsy punch. And when my results came back after like a month, the doctor told me that they are scared that I may have something like cancer. And I didn't take this so seriously because in my family, all the generations, we don't have any person that has ever suffered from cancer. And this cancer that he was telling me, I had never heard about it. So in my mind, I said, this doctor just wants to eat my money. Because first of all, it was a very expensive hospital. So he was telling me we have to do other investigations, we have to do MRI, we have to do CT scan, we have to do a bone marrow biopsy to check, and all these things cost a lot of money. So I said, this doctor is a joker. So I thought he was lying. So when he was telling me so that I was not serious, so he became serious in his doctor tone and told me, Jasmine, I am very serious. This is a serious case and we need to investigate it further. Would you like to continue with us, or I refer you to the Uganda Cancer Institute? I told him, refer me to Uganda Cancer Institute, because now my mind was very disturbed. And I told him, give me my results and I go. And I was very angry. I thought this hospital, because I had paid a lot of money for these tests, and this is the bullshit that they are giving me. They are lying. In my mind, I was like, they are lying. So the doctor gives me my results and I go out. So he calls me. He says, Jasmine, I am very serious. I have made for you an appointment with a doctor at Uganda Cancer Institute who deals with your kind of cancer. Make sure you go there tomorrow. It was a Wednesday because the clinic of my doctor sits on a Wednesday. So when I saw that he was serious, I said, okay. So I went to Uganda Cancer Institute. We redid the tests again. 2 times, and the results came out both positive, that 2 times that we tested. And it was discovered that I have the cancer is called mycosis fungoides. It is a kind of cancer that attacks the white blood cells. It is a cancer of the blood. It's a T-cell lymphoma. It attacks the white blood cells, the T cells. We should say that like the immune system. The T cells are the ones that fight disease in the body. When you have like cough, flu, malaria, they are the ones that come and fight. But because my T cells are cancerous, they cannot recognize themselves as sick. So even when I received chemotherapy, they would fight the chemotherapy. So I did not achieve the desired results that I would have achieved for the other patients. Like, I received the first cycle of chemotherapy that was 6 months, but it did not work. So the doctor changed for me and put for me on another form of chemotherapy, and I did the cycle for 8 months. It worked for like 98%, but after 2 months I relapsed. So he had to put me back on chemotherapy, and I did 6 months, but nothing totally changed in the 6 months. And when you're receiving treatment, there is a maximum. So after 6 months, the doctor said, you have reached your maximum chemotherapy. We cannot